Acute febrile illness is one of the most common presenting symptoms globally. Each year, in sub-Saharan Africa alone, over 600 million humans, the vast majority of which are young children, present complaints at their local healthcare facilities. The causative agents tend to range from viruses to bacteria to parasites, most notably the malaria parasite, and the symptoms are overwhelmingly similar, thus making effective diagnosis difficult, especially in the absence of critical healthcare infrastructure by means of the right kinds of diagnostic tests, kits, reagents, skilled healthcare personnel to administer the test, interpret results, and guide treatment, and also the basic amenities of clean drinking water and electricity to support this healthcare infrastructure. Now, as a result of this lack of infrastructure, patients, providers, and practitioners alike turn towards a syndromic approach in trying to diagnose the cause of illness. The practice on relying on clinical presentation as opposed to evidence-based testing has a high error rate. It leads to prolonged patient illness, increased patient morbidity for otherwise treatable disease, and also the creation of superbugs, drug-resistant microbes that are no longer responsive to current treatment methods. As a matter of fact, the World Health Organization estimates that between 700,000 to a few million humans each year die from drug-resistant infections in the developing world. This number is estimated to climb up to 10 million a year by the year 2050. My name is Lakshman Wadwani, and I'm the founder of Diagnosing Africa. We're a concept stage development company that has spent the last 6 years looking to solve the riddle of diagnosing acute febrile illness in sub-Saharan Africa. The long-term solution is to build capacity for diagnostic innovation, and we believe that technology transfer and local production can be an effective and sustainable strategy by which to build health security. This not only leads to a decrease on the reliance on imports, an increase in the reliability of supply of essential diagnostics, leading to lower prices, but also encourages the development and production of essential diagnostics that are more suitable for local healthcare needs.
The WHO came up with a set of criteria to describe the characteristics of an ideal diagnostic suitable for resource-poor settings. The acronym ASSURED, which stands for Affordable, Sensitive and Specific, User-Friendly, Rapid and Robust, Equipment-Free, Deliverable to End Users, was coined by the WHO to describe such characteristics. The acronym is behind the philosophy of our innovation and product design. We would be using lateral flow technology for the assay. The most recognizable embodiment of this technology is the simple pregnancy test, which is equipment-free, user-friendly, and rapid. The innovation behind our product will be driven by the recent identification of reliable plasma-detectable biomarkers that can discriminate bacteria from viral and malaria infections. We would also be using aptamers instead of traditional antibodies. Aptamers are synthetic molecules that can be raised against most targets. They can be easily stored and delivered, are heat stable, thus obviating the need of a cold chain supply, and due to the ease of production, sourcing is guaranteed with high batch-to-batch reproducibility. And lastly, aptamers are several scales cheaper than antibodies. We have the solution.
The order of business will begin with base pair technologies, where they'll kickstart with our aptamer development program. Then it's off to Carlsbad, California, where DCN Diagnostics will conduct feasibility and prototype development and final product development, followed by the transfer of technology to Accra, Ghana, where official business activities will commence as well as commercial production.
Diagnosing Africa has built a highly qualified team with strategic partnerships. As the founder, I'll be focused on business funding, strategic partnerships, and leading our organization through R&D, clinical trials, and commercial production. Nevi Popolambo has a PhD. She has extensive experience in instructional design, knowledge management, training, curriculum analysis, evaluation, and technology project management. Sunima Chaudhry has an MPH in Global Health Systems and Management and Policy. She is skilled in nonprofit organization, project management, product development, market policy analysis, research, and evaluation. Bill Jackson has served as the principal investigator on 15+ small business innovation research grants and projects, and is the co-investigator on several more. He's a primary inventor on 12 issued and 20+ pending patents. Brendan O'Farrell is the co-owner and president of DCN Diagnostics. He has over 27 years experience in the development, manufacturing, and commercialization of rapid diagnostic tests. He will be leading our final product development.
We are seeking seed stage funding in the amount of $120,000 in a safe or convertible note. This money is going to go towards our aptamer development program, intellectual property costs, and also preparation for feasibility and prototyping in our next stage of the project. We're really excited to be partnering with you to make a huge change in global health with this revolutionary new diagnostic. Not only will your investment give you a good return on your money, but you're going to make a huge social positive impact. Take a look at our website at www.diagnosingafrica.org. Come a little bit closer and let's see how we can build a fruitful partnership.